Let's look at the story of David, who flew all across from United States to have his dental implant treatment at Rajan Dental. Here was a man in his mid-40s, having lost some of his natural teeth, and he had replaced it with dentures or removable dentures. He also had very few teeth left, most of them not very functional. They were either a little loose, they were shaky, and this patient happened to be also a foodie. So here he was with a few teeth in prime of his life, not able to eat his favorite foods, avoiding some of his best or favorite foods, avoiding some of the best restaurants. So he was advised that he could have all his teeth removed and have implants and fixed artificial teeth. So he reached out to us and wanted options. So when our options that we gave was almost very similar to what options he had from his dentist in the United States, he was fairly convinced that this was the right way to go about his treatment. So there were two individual opinions which almost completely matched. So then we asked him to send some of his radiographs, some facial photos, and then a cone beam CT, all preliminary requirements so that we could plan better. So when he sent all these requirements to us, we went through another video discussion with him, talking to him about the type of implant that we'll be doing, the brand that we'll be using, etc. Obviously, we use only a couple of brands for people who come from outside India, because there are only 2 or 3 brands. Although there are more than almost 100 brands of implants today all over the world, only 2 or 3 are practiced universally, which means unless I'm able to practice that and give those patients that, they will not be able to have a follow-up in their country when they go back. And this is very important. See, once you do implants and you give artificial teeth, once a year visit to a dentist for a checkup, follow-up is very, very important. So when we talked to him about the brand of implant that we were using, he was convinced that this was a good place to go to, and we knew what we were talking. So he came to India, and we went through this process in about 10 days. We could finish his complete treatment. We removed the teeth which are not very functional, did implants, and he had a full set of teeth, artificial teeth, for his entire upper and lower jaw. He spent an extra week doing some sightseeing locally and went back to US. He came back about 9 months later for what we call as the final processes, because it takes about 6 to 7 months for the implants to completely integrate. And he also had to have what's called some special implants called the Zygoma implants. And now these Zygoma implants are done when patients do not have sufficient bone in the upper jaw. What were we doing earlier? Earlier, we used to take bone graft from the patient's own body, different part of the body, usually from the lower jaw, sometimes from the hip bone. If you have large volume of bone, you need to go to the hip bone. And so it becomes 2 major surgeries, doing a hip bone graft, and then you wait for about 4 to 5 months, then do the implants, wait for another 6 months, and then only do artificial teeth. Whereas the alternative, what we call a Zygoma implants, is called a graftless technique or no bone graft technique. So this has 2 big advantages. 1, very fast treatment. 2, you do not have to go and take bone from another part of your body. So this patient had extraction of all his teeth, Zygoma implants, and a few other regular implants, and fully fixed artificial teeth in 3 days' time. And when he came for stage 2 after 9 months, we just had to take measurements and replace those teeth with a different material, a titanium framework with zirconia teeth. So that's a long-lasting solution that should last easily about 20 to 30 years for the artificial teeth. And if it gets worn out after that, the teeth can be changed. But the implants themselves can last easily up to 60 years. So these are all very, very long-term sort of treatment. Important, of course, is that he follows it up every year. Every year he has a follow-up with the dentist. Even last year he sent us his most recent X-ray and also his photograph of his smile. He's very happy, and he has, been a big brand ambassador for us, and he has sent again a couple of his relatives from different parts of the world. So it's very heartening to see that we can help patients from not only India, but all across the globe. So if you have a question, if you have a doubt, if you have a need, especially regarding Zygoma implants, feel free to reach out to us at Rajan Dental.